why do we want these objective measurements? And what I'm going to focus on the rest of the time really is looking at predicting implant survival. And so this is some numbers that I talk to my patients about because, oftentimes patients will come in and think that implants are 98, 99% successful. And, while implant success and survival is very high, we have to think about certain things such as area of the mouth, placement and loading protocols, and of course, medically compromised patients. And so when we look at the area of the mouth, of course, as we've already talked about, the mandible generally has higher ISQ values, and it also has higher survival rates. Of course, the highest survival rate, as we would expect, would be the anterior mandible, where the quality of the bone and the quantity of bone is generally the highest. If we look at patients and their medical problems, we look at patients that are older age, we look at patients that are smokers, diabetics, that have had radiation therapy to the jaws and are postmenopausal females. Those are going to be the patients that have a higher increase in implant failures. And so utilizing some objective measurements, especially in these type of medically compromised patients, is going to be really, really helpful in making some of these treatment protocol decisions.